Hi, my name is Jackie McCarg, and I am doing a video presentation for my healthcare economics class at UALR. We are to come up with a report on a new idea for healthcare or something that's not very well known, and I chose to do it on this little bitty device right here. It's called a swabcap. And what this does is it helps prevent central line blood infections. Central line catheter-related infections kill about 31,000 hospitalized patients every year, and either when they're put the catheter is placed, or when people, nurses, doctors access the line without using the proper sterile technique or aseptic technique. Many hospitals have already seen that these infections can be reduced to zero and that they can be maintained at zero. But you have to be vigilant in keeping the hospital and keeping the nurses and the staff using their aseptic technique. Peter Pronovost, MD, Medical Director for the Center of Innovations and in Quality Patient Care at Johns Hopkins University, added that the report from the CDC marks a turning point in transparency and accountability for health care, with the published results of 18% drop in central line infections. Central line associated bloodstream infections are the polio campaign for the 21st century, according to Dr. Pronovost. He's well regarded as for his 5-step checklist, a sterile procedure by which providers avoid contaminating lines leading into patients' bloodstream. This checklist also empowers observers who notice a misstep to call a stop to the line insertion process. And I have actually had to do that in my nursing career. I had to stop a doctor because he had broken sterile technique, and he was not too pleased with me. Anyway, we know about biopatches. They're the little patches that are blue on one side and white on the other, and you put those around where the actual insertion site, and they have time-released chlorhexidine that comes out, and that keeps MRSA and other infections from getting in. But a lot of the times what you have is you have that on there, but then you don't have anybody really cleaning the hub or the lure lock device when they go to access the central line. And this is a small lure lock device that is attached to the end of a central line using for demonstration process. And this is our swab cap. And what you do is this has isopropyl alcohol in it, and 70%, and it's used as a disinfectant. And it's single use, and it will disinfect the valve or the lure lock device 5 minutes after application and act as a physical barrier to contamination up to 96 hours under normal conditions when not removed. Okay, and you just push this on here, you saw, and then it sticks on and it stays on the end. Now what this does is it's intended, it not only has a physical barrier so that nothing can get in there, but it also kills anything that might already be on the lure lock device. This also means that when the nurse goes in to access it for either an IV, like a antibiotic piggyback, or to give medications, and she happens to not have any alcohol pads, and she's tempted to not, do I want to go all the way back to the desk and get alcohol pads, or do I just want to fudge it this time? I've seen nurses do it. This way, this keeps it's clean. All she has to do, take it off. It's clean. It's sterile. Give her medication, and then when she's done, flush and put a new one on, and it's good to go again. Swab cap is intended for use on swabbable lure lock access valves as a cover to protect the lure access valve from potential contamination. It acts as a physical barrier to contamination between line accesses and also serves as a disinfecting cleaner for use prior to line access. And this right here is just another step in protecting the patient from central line bloodborne infections. Thank you.